Hello, in today's discussion, I will talk on an approach to a perianal itching or Pruritus Ani. Pruritus Ani is a common skin disorder that manifests as itching arising in the anal or perianal areas, which usually produces serious discomfort in the patient. It affects from 1 to 5% of general population, most frequently men. But the overall prevalence is difficult to estimate because of majority of people that are affected with perianal pruritus doesn't go to physician. The nerves responsible for pruritus are unmyelinated C fibers, and the histamine is the main peripheral mediator of pruritus. When we see the common cause of Pruritus Ani, there are medications, diet, mechanical, inflammatory, infectious, systemic diseases, and the malignancy that causes Pruritus Ani. So most cases of Pruritus Ani are secondary to a precipitating factor such as infectious agents, excessive use of soap and detergent, fecal soilage, dietary irritants, and the most common cause of condition vary according to the age group of the patient and their socio-economic condition. In children, the most frequent cause of Pruritus Ani are probably infection in origin. Among the intestinal infections, pinworm is the most common cause of perianal pruritus in children, especially in Africa and Asia. In these cases, pruritus Ani occurs predominantly at night and is caused by an inflammatory reaction due to the presence of adult worms and eggs on the perianal skin. When the host scratches, eggs become lodged under the fingernails, thereby augmenting transmission. Secondary bacterial infection may occur if the excoriation is severe. Other less frequent cause of perianal pruritus includes in children Hymenoplepsis nana infection, scabies, candida, and herpes infection. Dietary agents such as coffee, cola, chocolate, milk, and beer have also been implicated as a causative agent for perianal pruritus, especially in adults. Anal pruritus can also result from a number of skin diseases, including contact dermatitis, psoriasis, and atopic dermatitis. Diaper dermatitis is a common cause of perianal pruritus in infants before stricter control. When we see the clinical presentation and the diagnosis, although itching causes scratching, this does not occur before the age of 3 months. Other symptoms include irritability, sleep disturbance, and decreased appetite in those less than 3 months of age. The physical examination might reveal perianal dermatitis and excoriation around the anus from persisting scratching. Patient may have an easily recognizable condition such as anal fissures, anal fistulas, papillomas, skin tags, external hemorrhoids, or rectal prolapse. Any condition that hampers efficient weeping of anus may allow small particles of feces to accumulate in the perianal skin and act as an irritant. Excessive sweating exacerbated by poorly fitting undergarments along with poor personal hygiene may also be noted during physical examination. Pinworm can be easily diagnosed by applying a transparent adhesive tape to the skin around the anus before bathing or using the toilet in the morning. The tape is transferred to a slide and the presence of pinworm egg may be confirmed by a microscope. Other parasites can be diagnosed by examination of stool samples. As previously stated, perianal pruritus can result from specific skin diseases, among others, psoriasis, contact dermatitis, atopic dermatitis, spaghetti disease, and the like. In this case, perianal pruritus will usually be one manifestation of a more generalized condition, so we will have other symptoms. When we came to treatment, because most cases of anal pruritus are secondary, treatment should be directed at the underlying etiology. Once these have been excluded, both general and specific measures must be initiated. General measures include limiting constipation and the diarrhea appropriately with either high fiber diet or stool softeners. Perianal pruritus may not be easily amenable to treatment because it can be the result of self-perpetuating cycle. For pinworm infestation, which is the most common cause of perianal pruritus in children, initial treatment consists of patient and the family education about hygiene and the fecal oral spread. Either mebendazole or albendazole should be used as a first line of treatment for pinworm infection. A single 100 milligram dose of mebendazole results in a mean cure rate of 95%, but a second dose is given after 1 to 2 weeks to help prevent recurrence due to reinfection. Albendazole is given at a dose of 100 milligram if patient is less than 2 years and 400 milligram for those older than 2 years. A single dose of albendazole repeated for 2 weeks achieves a cure rate close to 100%. In the case of idiopathic pruritus ani, or those in which you do not identify the cause, we should have to apply lifestyle modifications such as no excessive cleaning, loose cotton underwear, bulking agent, and a low pyramide, and also dietary modifications and the topical steroids and the antipruritic agent, and also sometimes systemic antipruritic agents such as antihistamines. Thank you for watching.